Hey, Diane. Welcome to the first episode of our new podcast, Mark My Words.
Hey, Derek. This is super exciting. I hope you're ready for your 15 minutes of fame.
Can't wait. So let me ask you a question first. How long have you been working at McGill?
Well, that is a closely held secret, but I'll give you a hint. When I started at McGill, the number one song was TikTok by Kesha, and TikTok, the app, hadn't even been invented yet.
Wow. So I remember when I started at McGill, my youngest daughter was still in diapers, and now she is in her final year of CEGEP and about to start the application process for universities. And I will say that McGill is at the very top of her list.
She is a smart girl. So I guess we've been here long enough that both of us have had a chance to meet a ton of really fascinating people at McGill, researchers doing work that is changing some of the most important areas of research that we could think of.
Exactly. And that's what this podcast is all about. So it'll be an opportunity for you and I to sit down one-on-one with some of the very best researchers here at McGill doing really exciting work around some of the most challenging issues in society, things like food security, cancer research, the ethics behind AI.
That sounds amazing. So we should get right into it, and people can stop listening to us and start listening to the experts. And the first expert you have is someone who is working on something that I think is super fascinating.
Exactly. Her name is Jill Baumgartner, and she works at the intersection of climate change and human health. And it was a really fascinating conversation I had with her. So let's cue it up. Welcome to the very first episode of our new McGill podcast, Mark My Words. My name is Derek Kassoff, and I'm delighted to be joined in our studio by Jill Baumgartner, professor and William Dawson Scholar at McGill's Institute for Health and Social Policy and director of the McGill Centre for Climate Change and Health. Jill, it is so nice to welcome you and begin this podcast series in conversation with a professor whose research I find so fascinating and meaningful.
Thanks. It's a pleasure to be here.
Great. So I'm really excited to jump into some of the specific elements of your research. But first, maybe you can share with us what first drew you into the field of climate change and human health. What's the origin story behind your passion and curiosity?
Yeah, so I grew up in the U.S. Midwest, and I was very fortunate because I grew up in a place that had really great environmental quality. And the first time I really confronted sort of poor environmental quality was I was working in China. And this was right out of college, and the skies were black. The water was quite polluted. We actually had a cholera outbreak while I was there. But the thing was, it was temporary and ultimately a choice for me, right? So I could leave if I wanted to, and there were lots of people in the communities where I was working where this just wasn't a choice for them. And we see this over and over again. Poverty drives environmental exposures, drives health impacts. So that was really a motivator for me to try to understand not only what these impacts were for communities, but also like what we can do about it, right?
Right. Wow. So we connect the dots. You end up here at McGill University. So tell me a bit about the McGill Centre for Climate Change and Health, which I believe was launched just last year. What guides the center's research, and what does it mean to work at the intersection of climate change and human health?
Yeah, so it may kind of seem strange in a faculty of medicine to have a Center for Climate Change and Health, but I actually can't think of a sort of more appropriate and urgent place right now, given what we're learning about the health impacts of climate change. So we know a lot from research happening here at McGill and other places that heat and wildfires impact things like cancer and cardiovascular disease. And so we wanted to have a place that we could focus on understanding these impacts and vulnerabilities. So who's most likely to experience these impacts, and also have a place that we could really work together as a community, right? So bringing this community together of people that are thinking about these topics, listen to people that are experiencing these impacts and try to understand how we can build resilience together. So it's really just, trying to build a community of people that care about this topic or experiencing impacts of climate change and trying to address them.
Great. So I definitely want to delve into some of those issues in more detail, but maybe we'll start by just taking a couple of steps back and thinking maybe a bit more big picture. So based on the research and scientific evidence at hand, what do we know about the connections between climate change and the frequency and intensity of natural disasters like heat waves and wildfires?
Yeah, so science on this is actually super clear. So we know that climate change is making extreme events more frequent, more intense, right? We have longer wildfire seasons. We have longer durations for heat waves. With something like heat waves, the impacts tend to be more direct, right? We have rising global temperatures. And I think, what we used to think about as being these maybe once in a lifetime heat waves, now we're starting to experience those annually, right? As we are here in Montreal. For wildfires, the link is more so on it's creating drier climates, right? So we're getting less rain, but it's also hotter. And so essentially it's kind of turning these our forests into like tinderbox environments, right? All it takes is a spark, and then all of a sudden you have these massive fires that are really hard to control. And that's what happened this summer. That's what happened in 2023.
So here in Eastern Canada, we've experienced yet another summer of intense heat waves, long stretches of days when the air was heavily polluted by wildfire smoke. How are these phenomena impacting human health? And are there specific populations you're thinking about that are most vulnerable?
Yeah, so the impacts of heat and wildfires, the mechanisms through which they work are different. So if you think about extreme heat, people have experienced, when you go outside and you just start to feel there's stress on your body, and basically what's happening there is that your body's cooling system is affected, and that puts stress on your lungs. It puts stress on your heart, and that's one of the reasons why you see people having heat stroke or other impacts related to just experiencing that heat. They can't cool down, right? For air pollution and wildfire smoke, I mean, for wildfires, there's these really acute risks that come from the fires themselves, right? People are displaced. They're put in danger from the fires. For the ones that are farther away from your community, that pollution can travel really far. When you breathe it in, it's these really small particles. They get into your bloodstream. They can get into your brain, and those have impacts throughout the entire system. So they relate to cardiovascular outcomes, respiratory outcomes, neurological outcomes. So when it comes to wildfire smoke specifically, I would say our strongest evidence is for respiratory outcomes and cancer. But we know from traffic-related air pollution and industrial pollution that likely there's other health impacts that we just haven't figured out yet.
Right. So let me ask you, I guess, the million-dollar question. In this sort of new era of climate change and global warming, have governments and public health authorities been effective at adapting their public health policies in response to these risks?
Yeah, I think we've seen some progress, but I would say that adaptation overall has been pretty uneven. So when it comes to heat, for example, there's some cities that have been putting in heat alert systems and cooling centers that people can go to. Same for wildfires, right? So when a wildfire happens, and you don't have mechanical ventilation in your house, like how do you get to cleaner air? And some cities have been better about issuing advisories so people are informed about the risk, but then also have places that they can go for clean air shelters. But I would say probably the biggest critique that I would have is that we're continually reactive. Right? We had these wildfires that happened in 2023. We get to 2025, and it feels very similar in how we're dealing with those responses. It's all, oh, this is happening. We need to do something about it. And I think, there really needs to be more investment in kind of long-term resilience, right? So how can we prepare communities in advance for next summer, right? So that we're not always caught on our heels and trying to adapt very quickly.
Right. And like you said, that once in a century weather phenomenon is probably going to happen again next year and the year after.
Yeah, I mean, people are calling it like sort of the new normal. I don't love that because this is not normal. These are really serious impacts, and we're experiencing them on a weekly basis in some cases. This summer, it felt like we were fluctuating between heat wave and wildfire, and then both all summer long. But we can do a lot. There's available technologies and interventions and things that we can do right now. We don't have to wait for them. So I think that's the thing that gives me a lot of hope.
Are there any countries or jurisdictions that right now are getting it right? And what broad lessons can we draw from those experiences?
Yeah, so I think there's a couple I mean, within the Canadian context, a really good example is looking at BC, right? So if we look at British Columbia, look at Vancouver as a city, right? That's a place that has experienced wildfires for a really long time. It's not that we didn't have them here, we just didn't have them with the same intensity that they had on the West Coast. And so they have some really interesting programs that they've done on community shelters that are used for both cooling and for clean air shelters. France has also had a number of interesting programs that they've put into place. So they had this 2003 heat wave that had major impacts across Europe, but especially in France. And they put in some really robust early warning systems into place, as well as national heat action plans. And those have been phenomenally effective in getting the word out before the heat wave hits, working with community groups so that people that are vulnerable, communities that are vulnerable, that they know what to do, how to respond, which are the places that they need to sort of prioritize for action. So I think there are good examples that we can follow, even here within Canada.
I guess it's interesting because when you think about hurricanes, tsunamis, governments, at least those jurisdictions along coasts, have plans, they have routes, they have ways to get out. When we're talking about heat waves, wildfire smoke, it's less visible, maybe, and less apparent to the average person.
That's true. But I will say, like, the lesson for all of those things is that, preparation matters, right? So we can prepare in the same way that we would for a hurricane, for heat waves and wildfires. We know they're going to happen, right? They're probably going to happen again next summer. They may even happen this fall, right? But I think making sure that we're investing in the social infrastructure and physical infrastructure, community spaces, improvements in housing, making sure that, our health care is responsive to these things, it pays off when those climate shocks hit.
Interesting. So how can universities like McGill support more effective ways to address the health impacts of climate change? In other words, what are you and your colleagues bringing to the table?
Yeah, so I think universities are a really exciting place to be when it comes to thinking about climate impacts and particularly this sort of resilience and adaptation. Like, how can we make communities more resilient to these impacts and better prepared for these impacts? Just at McGill, we generate all of these novel data and an understanding of climate health risks. But as researchers, we also talked with people. We talk with people who are impacted by climate and health. We work with communities. We work with policymakers. We try to understand what their needs are. Like, what do they need from us, right? And, the complexity of these challenges that we're dealing with, they don't fall within any discipline, any political party, any administrative ethnicity, right? These are we have to work together on these problems. And so I think universities are a great place for that because it brings together people from all over Quebec and all over the world. It brings together people that think similarly to us, but also really different, right? So it's a great place to kind of think together to solve these grand challenges.
Right, makes sense. Can you share an example or two maybe of the kind of research projects underway in your lab or elsewhere at McGill that's having a direct influence or contribution to how we understand and modify public health policy around climate change?
Yeah. So I'll give a couple of examples. So, and they're really nice, I think, interdisciplinary examples that I couldn't have done on my own and had to do with colleagues. So one example is I work with a colleague who works on child marriage. Right, so marriage before the age of 18. And she had been talking about how one of the major drivers of child marriage is acute shocks. Right. So when you have an acute economic shock, like loss of agriculture or, loss of your job, your work, your livelihoods, then families, they kind of don't know what to do. Right. Like, you don't have that income. And so they'll either marry off their daughters. Usually it's their daughters. Or what they'll do is taking advantage of bride prices or groom prices that will motivate the decision to marry off a daughter earlier than they would have otherwise. And one of the things that we started talking about was that climate change and extreme weather events specifically, those are a big driver of these acute economic shocks, right? So when you have a flood or a storm or a drought, it impacts agricultural production, it impacts jobs, right? So we worked together to investigate at a global scale. So we did a study in 99 countries to evaluate whether or not there was a relationship between basically these extreme weather events, so droughts and floods, and child marriage. The interesting thing about it is we pretty consistently didn't show an effect. So there's something about communities where they're resilient enough to these impacts that they're not making this decision to marry off their daughters. And so this raised a whole bunch of other interesting questions that we work with UNICEF on to try to understand, what are those resilience pathways for these communities?
Right. Using those communities or that situation as an example to
Yeah,
build resilience in other situations.
yeah, exactly.
Wow. So you mentioned the interdisciplinary nature of that project and some other ones you're working on. So maybe that's a good opportunity to ask you about McGill's and very ambitious plans to redevelop the old Royal Victoria Hospital into what is expected to become the world's leading hub of climate change, sustainability, and public policy. And I know you've been very involved in that project
Yeah.
through your research and through your work here at McGill. What has you most excited about that project, and how will its collaborative design model support the kind of outside the box interdisciplinary research that we need to build this climate resilience?
The excitement around from a researcher's perspective, right? I think the excitement about having a space where researchers can be working together, where our students can be working together, where we can have co-advising, where we're bringing in partners from industry and partners from government and other community groups, like to work on these grand challenges, right? So climate change and health is, like I was saying earlier, it's not going to be solved by any one discipline on its own, right? So we really do need to be listening to communities, listening to what, industry is struggling with, and being able to be reactive to that. And I think, the opportunity of just being in a space together, in my experience as an interdisciplinary researcher, the best interdisciplinary science is organic, right? You sort of start conversations with each other. You have a quick question to a colleague for me in engineering, where I'm like, I'm thinking about this, what are your thoughts? And when you're all in the same space and kind of able to build that trust and that community and those ideas together, it leads to really exciting and impactful outcomes. So for me, I think we'll be able to continue doing the work that we're doing, which is amazing. McGill has a ton of amazing researchers who do really interesting and cutting edge work. But I think that the ability to actually do the work that communities want in a way that is integrated across disciplines on these big problems that are hard to manage and hard to for any one individual researcher to do is very exciting.
It feels like society has been talking about climate change for decades now, but it feels to me like we're maybe at a bit of an inflection point where people are finally starting to take it seriously. Would you agree with that? And do you see that reflected in the kinds of students that are attracted to McGill and attracted to the kinds of courses that you're teaching?
Yeah, I mean, so interestingly enough, one of the drivers for our center was that medical students and nursing students really wanted to have content on climate change and health. They knew that their patient populations were experiencing these impacts and they felt really powerless. Like, what do we do about this? How do we, when there is a heat wave, what do we do, right? Like, how do we respond in a way that's going to be effective and equitable? And so we definitely feel that demand that's coming from students. I think when I think about this sort of more broadly from the public, so I've worked a lot in the global south, and I would say in many of the communities where I work, they have been experiencing impacts of flooding, impacts of heat waves for a very long time. So I work in Bangladesh. Obviously, that's a place where flooding and heat waves has been a major problem for many, many years. And you have, in fact, about 20,000 people per day moving into Dhaka because they're forced out of the countrysides because of floods. So, they had been experiencing those in very, very real ways. I think in Canada, we're now starting to experience those impacts in the same way that other places have been for a long time. So with heat waves and wildfires. So it's not that these impacts didn't exist in the world. It's maybe that we didn't feel them or experience them in the same way that we are now.
And now we are. Exactly. Interesting. So before we wrap up, I don't want to put you on the spot, but I will. I'll ask you this. If you could implement one transformative change today to improve health policy around climate change, what would that be and why?
Yeah, I mean, so this probably won't come as a surprise to many because we've been writing about this in op-eds and various things for a long time. But I think we need to invest in indoor environments, right? So if you think about the amount of time that we spend indoors, it's about 90% of our day, right? And we need to be able to provide clean, cool indoor environments for everyone, but especially vulnerable populations. Children going to schools, going to daycare. We need to provide it in the workplace. So people, when they're going into the office, they're going into work, they have a safe place where they can go. We need to provide it at hospitals, and we need to provide it in elderly care facilities. So I think, the technologies exist to do this, but we really need an investment in infrastructure right now. Like that needed to happen 10 years ago. We need to start that now. Clean air inside homes, cool air inside homes and workplaces.
Right. Well said. And then maybe it's a really good place to leave this conversation. But I want to thank you, Professor Baumgartner, for sitting down with me today for this inaugural podcast. To our viewers and listeners, stay tuned for another episode of Mark My Words next week. New episodes drop every Wednesday, and you can find us on Apple, on Spotify, or wherever you get your favorite podcasts. Or subscribe to the show and you'll never miss a new episode. Mark My Words is a production of McGill University Advancement in collaboration with the Department of Communications and Institutional Relations. Special thanks to our producer, Frank Roop, and to my co-host, Diane Fagan, who will be leading our conversation next week. Thank you very much, Jill.
Thank you.
It's a pleasure.